Hi, my name is Dillys Larbi. I'm a PhD student at the Norwegian Centre for E-Health Research and UIT, the Arctic University of Norway. I will be presenting my PhD project, a social media chatbot for increasing physical activity behavior, the FISBot. Regular physical activity promotes both mental and physical well-being in people of all ages and abilities. Yet, it remains challenging to engage large populations of adults in public health interventions aimed at increasing exercise behavior. Globally, 1 in 4 adults are physically inactive. That is, about 25% of adults in the world are physically inactive. In Norway, that has a relatively active population. The prevalence of overweight is about 50%, and that of obesity is about 23%. Life-altering events like the COVID-19 pandemic we have been living with these past few years tend to promote sedentary lifestyles as most people decrease their physical activity and simultaneously become more active on social media platforms, including gaming communities. Furthermore, the pandemic highlighted the differences in access and opportunities for physical activity. Generally, physical activity interventions for adults delivered through digital technologies have been shown to be effective. However, those incorporating social media have demonstrated higher effectiveness and higher levels of engagement. Chatbots are quite new to the healthcare sector. They are computer software programs based on statistical learning, statistical analysis, and educational theories that mimic a human conversation. Chatbots are easy to use because they usually do not require familiarity with a specific interface like most apps do. The use of physical activity chatbots is associated with an increase in physical activity among users. With about 98% of the Norwegian population having access to the internet and using social media, integrating a physical activity chatbot into a social media platform could be a highly cost-effective public health tool. The main aim of the PhD project is to determine the feasibility of a social media chatbot for increasing physical activity behavior. The concrete objectives of the project include to explore overweight and obese individuals' preferences for the chatbot and integrate these into a prototype, to explore whether the resulting social media chatbot, that is a FISBot, can be used to generate a physical activity behavior change, and to explore users' acceptability and satisfaction with the FISBot. We have developed 2 social media chatbot prototypes, Maya, an English chatbot, and Actimutbot, a Norwegian chatbot. Both prototypes were integrated into Telegram, a free mobile and desktop social media app, and they were tested among adult volunteers in Norway in a usability study. Maya's features included, among others, challenges, simulator step count, and small talk. Actimutbot was integrated into a step counter and could report a user's step count in real time, and users were able to input all kinds of physical activity. Maya was available to Android and iPhone users, while Actimutbot was only available to Samsung users. After using the chatbot prototypes, users answered a survey that included the chatbot usability questionnaire. The 2 chatbot prototypes were both perceived as welcoming during initial setup and having realistic personalities. However, users reported that both chatbots failed to recognize a lot of their inputs, seemed too robotic, and it was easy to get confused when using them. Half of the participants in the usability study for the Actimutbot reported increased motivation while using the chatbot. The main reason for integrating a chatbot into a social media platform is to take advantage of the fact that most people already have social media apps on their phones and therefore are not required to install a new app, which usually discourages people from using digital interventions. Although Telegram is a relatively secure social media app, it is not popular in Norway. Therefore, most participants had to download the app, and this was not appreciated by some. Ideally, users should be given the opportunity to decide on the social media app to integrate the chatbot, which would most likely be one that is already installed on their phones. For the PhD project, we will endeavor to achieve that. This project is a mixed method study that involves both quantitative and qualitative data collection and analysis. The project has 3 phases. Phase 1 is preferences and development of the FISBOT. It will involve exploring the interests and preferences of obese individuals through focus group discussions and individual interviews. Phase 2 is a 12-week pilot study to determine the feasibility of the FISBOT and assess behavioral change associated with its use. Phase 3 is user acceptability and satisfaction, and it involves exploring users' views, experiences, and challenges with the FISBOT through individual interviews. Volunteers will be recruited from among individuals referred to Evia Klinikken. Evia Klinikken is a clinic that specializes in the treatment of morbidly obese individuals. The clinic attends to about 700 overweight and obese individuals from all over Norway in a year. Recruited participants should be adults aged 18 years and above and should be relatively healthy. That is, they should not have any severe health condition that prevents them from doing physical activities without supervision. Emails will be sent to individuals on Evia Klinikken's waiting list, and posters and brochures will be placed on the clinic's premises to attract the interest of those currently receiving treatment at the clinic. Using the social media chatbot in this project will not replace treatment at the clinic, nor will the refusal to participate in the project affect the course of treatment. If we do not get enough participants from the clinic, we will try to recruit overweight and obese individuals from all over Norway via social media. The design and development of the social media chatbot will involve integrating the preferences identified during the focus group discussions and individual interviews into one of the chatbot prototypes. The FISBOT functions will be based on a set of rules, and therefore it will respond exclusively to specific commands. User interaction with the chatbot will be based on pre-established dialogues that offer different options to users as a response. The chatbot's dialogues will follow the framework for health counseling dialogue systems. FISBOT users will interact with it via the regular chat function on a social media platform. The FISBOT will send messages based on user action or a time delay, and these responses from the FISBOT will not constitute medical advice, and the information provided will promote physical activity and discourage sedentary behavior. We will conduct a usability testing to identify technical issues in the chatbot's content and design. A physical activity social media chatbot integrating users' preferences might be an innovative and effective way to increase physical activity among overweight and obese individuals, and perhaps the general population. A physical activity social media chatbot could be used on a larger scale across Norway and could be relevant to efforts that promote and encourage healthy lifestyle among social media users. A social media chatbot proven to be feasible and acceptable for increasing physical activity behavior in obese and overweight individuals could potentially be extended to improve diet, reduce substance abuse, and promote preventive measures. It could be generalizable to other countries, at least high-income countries. Thank you very much for your attention. For more information, please contact Dillys Larbi at ehealthresearch.no.